So I just wanted to make a little video to explain how we like to use the foam roller here in clinic. We tend to use the foam roller for issues related to the thoracic spine, which, as a lot of you will know, can become extremely rigid and tight through modern postures, modern lifestyle. And a lot of patients really find a huge amount of relief and increased mobility from sort of playing around a bit with the foam roller. And the best thing about this piece of kit is there's really no rules to follow when you utilize it. You can kind of just go with your instincts. So basically, if you're rolling around and a certain part feels nice, you're rolling around here, if that feels good, just go with that. You just follow your instincts. So Will is going to show us a few things that we tend to recommend. So if you lie on your back, sort of with the foam roller on your thoracic spine, perfect. Look, the first and simplest thing is to just sort of roll around the foam roller on your mid to upper back. And you may even get a few little nice sounding clicks and pops, which is not the goal of this exercise, but can also, it can feel quite nice. But you're just basically doing a little self-massage using the foam roller here. We can then progress this to an exercise I really like, which we call a beach stretch. So what Will's going to do is put his hands behind his head like that. You can see why it's called a beach stretch, because you can imagine yourself lying on a beautiful Australian beach, just relaxing. And what Will is doing now is adding some mobility to that exercises. So he's coming into thoracic extension here and now into flexion of the thoracic spine. By bringing the elbows back, you're also getting a really nice stretch into the pecs, into the shoulders. And by crunching in, you're really moving that thoracic spine through a nice range of motion. And what you can do now, for added complexity, should you want it, is change the position of the foam roller. So Will, if you move the foam roller slightly down your T-spine, perfect. You've now got a slightly different fulcrum point. So you're getting a bit more movement into a different part of the T-spine. So Will is now actually moving from a lower part of the thoracic spine. So this is really great because you can target the areas that are immobile, the ones that are likely giving you problems. As a final stretch, what I also like to do is just bring the arms overhead into flexion. Beautiful. And you could just sort of hang out there. That's a nice deep stretch into the shoulders and the pecs and the lats. But really with the foam, thank you, Will. Really with the foam roller, just play around with it. If you mess with it, roll it into your lats, roll it into your upper back, you'll find the positions that feel relieving and feel comfortable. And that can give you a huge amount of benefit, mainly for pain relief and mobility.